I am pleased to welcome you to the Norwegian launch of the 2024 report of the Lancet Countdown on Health and Climate Change, a multidisciplinary collaboration monitoring the links between health and climate change. The report provides annual updates and provides decision makers with evidence-based recommendations. The Center for Global Health has had the honor of hosting the national launch since 2019, and lately in collaboration with the steering committee of the Norwegian Planetary Health Alliance. And if you're interested, please visit our website to learn more. Before we get started, I will review the house rules for this event. The event is being recorded. Following the event, the recording will be made available online. We encourage the audience to engage during the Q&A by posing questions, which can be done at any point during the event using the Q&A button at the bottom of your screen. And you can include your name or you can post it anonymously. As underscored in the 2024 Lancet Countdown report, climate change is a global phenomenon, impacting all countries directly or indirectly with important consequences for health. There is an urgent need for a just and equitable transition towards health and sustainability, through which climate change mitigation and adaptation are achieved in tandem with minimizing global inequities, saving lives, advancing health, and safeguarding livelihoods. This event will address climate, nature, health interactions and impacts in Norway and lend attention to key questions around energy. We will be joined by a speaker from the Lancet Countdown, who will provide an overview of the Global 2024 report, followed by several national speakers who will address matters important here in Norway as well as internationally. Our first speaker today is Ian Hamilton, Vice Dean of Research at the Battle Faculty of the Built Environment, University College London, and Professor of Energy at the Environmental and Health Energy Institute, University College of London. Ian Hamilton is among the co-authors of the 2024 Global Countdown report and was the lead of the Countdown Working Group 3. He will provide us an overview of the 2024 report. So please, Professor Hamilton, the screen is yours.
Thank you very much, Jeanette. And thank you to my fellow speakers and also to all of you in Norway for joining today for this launch event. Very pleased to be able to undertake this, and actually it's, I think, my second time of helping the Norwegian launch event. So on that, I'd like to share a presentation which we have outlining and overviewing this year's report. And as Jeanette highlights, we are facing record-breaking threats, and this is accumulating with delayed action. So the concerns that we have ultimately are those of inaction threatening health. So this is our, in fact, 8th report of our indicators, and these are always aligned to inform and feed into the COP29 discussions, and in particular this year, this new collective quantified goal, a really vital action area so that we can ensure that the financing is going to become focused on health alongside the climate mitigation and adaptation actions we so desperately need. What this does is it draws together so many authors from around the world, across 57 academic institutions and UN agencies, and we present indicators across these domains. What's new in this report? Well, first and foremost, as highlighted, we are facing record-breaking levels of threat. We see that on a daily basis, and that's accumulated again into these annual indicators of change, increased hazards in terms of heat, flooding, disasters related to those, the health impacts, associated emissions. The reality, though, is that we still maintain hope. There are opportunities to build on. We have 11 priority areas of action, and we're emphasizing that these are a key part of how global and national responses can be brought in. We have new indicators ranging from exposures through to impacts, through to the way in which different financial choices are going to be affected. And ultimately, every year we seek to improve how our information is updated. I'd like to start with three main messages. The first, we're facing these record-breaking threats, and that's a risk to our health and well-being. And the reality is that our survival and the way in which our healthcare delivery is capable of responding to these threats is under stress. We've seen 15 indicators that relate to exposure change. 10 of these are reaching record new levels. So this is a huge concern. The second, and most importantly in many ways, is that governments and companies continue to support these actions in terms of risks around climate and energy, and looking at ways in which the lack of action around decarbonization is threatening not just those who can afford, but at risk those who can least afford. We do have evidence of things moving very tentatively in some of the right directions. And this is where, for example, increased investments in renewables, the way in which companies and organizations are divesting from fossil fuels, as well as different actions that countries and city governments have around adaptation plans. The recognition that climate change is a health issue, I think, has progressed enormously, but in doing so, we now need to see the actions. Again, something new for this year's report, we have set out a series of key recommendations and then how those will correspond into the debates that national and international governments have. The first, and I won't list these out, I won't read them out, but ultimately they're focusing on putting health in the forefront of the types of commitments that governments are making. As a result of that, ways in which we can invest in that healthy future and ensuring that we're putting the money behind those efforts to ensure that health is protected alongside them. What that does is ensures that we have ways by which to converse and monitor and track change, and then ultimately to be able to make these larger international agreements reflective of health and climate justice alongside that. Efforts around the health system and ensuring the capacity to continue to deliver quality health services in a low carbon fashion and to grow in areas that have a lack of health services is extremely important. And ultimately, what we see through is by using public health as an intervention tool, we can better support climate and climate commitments alongside health benefits. So these are the many covers that we've had over the years. And this year's report, again, evokes a reality that many are facing, which is an exposure increase alongside climate change. We are so grateful to all the many partners that we have who contribute to these reports every year. And so what I'd like to do now is highlight a few of those indicator areas in the time that I have. So for those who are familiar or not, we have 5 working groups related to climate change, related to adaptation, mitigation, which is what I lead, economic impact of this transition, and then the public and political discourse and context. And we highlight indicators across all of those that have implications around what we're looking for in terms of health impact and health protection of climate actions. So I'll start with a few of the climate-related risks, and I'm not going to dwell on every part of these slides because I think in many ways the figures speak for themselves. And what we do see, as in both of the exposure of infants to change in heat wave occurrence over time, is this increase. We see continuously the increase in these trends. So in the case of those who are at risk of heat-related mortality or morbidity, those who are very young, very old, the occurrence of incidence of risk continues to climb. We have 13.85 days of heat wave per person as a record. What does that mean of heat exposure in terms of the working population? Well, we also see a huge increase in the amount of hours lost due to heat. There is physiological limits that people have the ability to work outdoors. Many of these occurrences are happening in medium and in low-income country settings, where again, so much work is done in this heat exposure environment. There's, of course, loss of productive hours, which has economic effects, but there's also a relationship that has to heat and heat-related mortality. And again, we see this increase accumulating. So compared to a relative baseline of a period prior to 2000, this has increased 167% higher. These are extraordinary changes and happening in a very short amount of time. The implications around heat exposure, for if there's maladaptation in terms of the built environment or simply just experiencing temperatures that are exceeding 45 degrees or more have a real effect on those who are most vulnerable, but also those, as I mentioned, in working environments. These types of heating conditions also feed into environmental change. So in the case of wildfire risk, for example, what we see when we look at the index numbers across the risk of fire conditions, fire weather, these have elevated. And this increase is going to place more people in danger as they get exposed to wildfire smoke alongside the heat. The reality is also we're experiencing large changes in terms of drought occurrence. And this is, again, related to which climate impacts on local water systems and the hydrological system around the world is that we're getting areas where there's large amounts of drought. In addition to that, pardon me, we have also extreme precipitation increased risks. And this is the reality of climate change. We see greater variability in day-to-day phenomena. So as we go across and we look at the ways in which, on one hand, you may have droughts occurring, and then in the same case as we've just seen in Europe, we have extreme weather events causing all sorts of catastrophic impact and life lost. So in terms of the exposure changes, these continue. What else does it affect? It does affect things like the suitability of vector transmission. So this is diseases from mosquitoes and the like. This is an illustration of what's happening for two types of mosquito and the risk of increase in dengue. And so again, the environment that hosts these types of disease vectors have increased and they're more suitable for transmission. Again, how healthcare systems respond to these and how monitoring systems are capable is a real challenge. Speaking to issues around adaptation, we've got increased recognition of climate change in national adaptation plans. So a lot more countries are looking at these, in which case they're hopefully developing plans. And of course, protection is one, but also prevention is going to be another route. So in both national adaptation plans, what we see is a lot more countries committing to these types of actions and ensuring that minimizing the risk from climate events through health is one of the ways in which they can ensure and protect health. Also related to adaptation is this question of, as extreme heat and raised risks of heat increase, what's going on in terms of the ability to ensure and protect health around cooling. So what we've seen in the IEA, International Energy Agency, described this, that as an end-use service in housing and buildings, air conditioning is the fastest growing energy use. Now, what does that actually mean? It means that for the most part, very high and high-income country settings protect with air conditioning, for which that has a greenhouse gas effect from electricity. So there's a real importance for decarbonization of the electricity system. But providing sustainable and fair and equitable access to cooling is really important. What we also find is that there's increased discussion among health education and training. So more and more healthcare training settings are putting in place education. We're seeing schools, countries, and curricula changing in order to better understand how climate is associated and affecting health. So these are positive things. The last few minutes, I'd like to take a little bit of time talking about the energy system, which is of interest, of course, to Norway. What we have here is a global emission, which is the highest of all time. This continues to be the wrong trend. We need to see emission of the energy system, which is 70% of all emissions associated greenhouse gases, to decline. And it's still not tipping over. This is exceptionally important because some of the risks around this, particularly in countries that are reliant on dirty fuels, and particularly those of a high fossil fuel content in terms of carbon, are continuously being used. And there is a real risk. In this case, we're looking at coal. The countries are not yet adopting to low carbon opportunities. And again, how they do this in a fair and equitable way is very important. One thing which we do see as a benefit is that renewable energy systems continue to increase in terms of investment. And so these are mostly happening among the very high and high income settings. So again, being able to direct investments and resources towards those who can least afford to ensure that their systems are not providing health harms. Very important related to that is the air pollution associated to fossil fuels. So again, what we see from particulates is a continued increase in medium settings, but high and low and very high are continuing to adopt more actions to mitigate the pollution coming from fossil fuels. What we do see those at the low income settings ultimately have very low levels of energy use and access. And so continue to be able to invest there in terms of renewables is exceptionally important. Another area that we look at is the overall picture of agriculture. This is around 26 to 30% of global emissions, and it's exceptionally important because it's related to something that we do every day, which is our diets. So looking at this, we see that cow and ungulates, so sheep, goat meat, etc., are a large part of global emissions. So this is where the opportunity that a healthier diet could lead to also a lower carbon agriculture system. So we see that by looking at ways in which diets that are more aligned to climate commitments could benefit individuals, but we do see that there's still a lot of risk around what is being consumed and the carbon content of that consumption. I know I only have a few minutes left, so I'll highlight these last few points. When we look at the way in which the extreme events are also affecting the economy, this is a very important part of how we understand climate to be impacting not only the health, but also the ways in which governments are going to be able to ensure and insure individuals in terms of the health responses. So in many cases, what we're seeing is that these economic losses continue to accumulate, weather-related events. But what's important in this figure is that blue bar are the insured losses, while the uninsured, this is just simply devastation for most individuals and settings, are not capable of being invested back in. So this is very much highlighting the risk and inequalities that exist within the economies of our countries. Related to that earlier point about heat exposure and outdoor working is that we do see a loss of earnings around labor capacity, and in particular, this is accumulated in low and median income settings. So again, the implications are that heat exposure, most vulnerable individuals, those working outdoors, and primarily those among low-income setting countries. What we do see again as an area of benefit and hope is that the jobs areas associated to renewables and associated to a low carbon economy continue to grow, particularly around areas such as photovoltaic and other bioenergies, etc. So this is again a way in which national arguments around investment, around decarbonization can contribute to economic prosperity and productivity. Alongside that, and I did have a highlight here for those in Norway, that the compatibility of fossil fuel company strategies with the Paris Agreement. So if you're above the line, it means that you are exceeding the ways in which emission reduction coming from oil production. While if you're below the line, there are alignments towards the strategy, but very few companies across the world are making the efforts needed to align. The net value of fossil fuel subsidies are a real concern because these have continued to grow, and a lot of this is associated to ways in which the emissions are not being properly priced into the economy, and that results in a risk that we continue to accumulate. The last few points I'll make, and I will close, is around individual engagement in health. Again, we see that the experience that people have, and this is ways in which information is being sought, continues to be there. What we're seeing is been an increase in understanding of health and climate change together through things like Wikipedia. But again, there's perhaps waning of interest or at least understanding how people are accessing this information. We certainly see a lot of scientific evidence around this and increases, and a lot more productive in terms of evidence, which surely should not be ignored. And lastly, we see and look at government engagement around this important area, continuing to hope that governments take that evidence, take the conversation, and make action. So I will also say that corporate events, corporate engagement to this continues to increase, but again, not to the level of extent of alignment. So the takeaway reports in my last slide are around the world, people face record-breaking threats. It is the governments and companies that are at risk, risking our health by not aligning, not taking seriously these commitments. But we do see some evidence of actions that are going in the right direction. And on that, I will end, and thank you very much for this time.
Thank you very much, Professor Hamilton. Really appreciated that. And it's extremely timely and very important to cover also what you talked about, extreme weather and insurance, because as we speak, Jacob system on the western coast of Norway is giving us terrestrial rain according to between 50 and 100-year level, and it's more than 100 millimeter in the last 24 hours so far, and it's still pouring down. So, thank you for this. This is a kind reminder to the audience that our first Q&A session will be after the next talk. So please post your questions in the Q&A as it arises so we can go back to them. And then welcome to our next speaker, Professor Vebjørn Bakken, Director of the University of Oslo Interdisciplinary Initiative, UIO Energy and Environment, who will address the topic of energy in Norway. So please, Professor Bakken, the screen is yours.
Thank you, Jeanette, and thanks to Professor Hamilton as well for drawing up sort of the background for this. So the topic that I have been given here is energy in Norway, which is a very broad topic. So I added a bit more provocative title. Powered by nature is a slogan that was used a lot a few years ago, and then I also added financed by dinosaurs, which is not really very precise, but we are really living off the fossil fuels, the oil and gas, and I'll get back to that. As was pointed out here, energy is really at the key here in terms of the climate gas emissions. So, well, the numbers varies a bit, but between 2/3 and 3/4 of the greenhouse gas emissions comes from energy use, energy production, energy use, and we really have to do something with this. So what I will focus on is basically one question, which arose in a meeting that we had recently, a seemingly simple question: what is the share of renewable energy in Norway? But this really has a lot of different answers depending on what you mean by share here. So I'll present a few numbers and sort of use those to do a discussion about the situation in Norway, kind of the current status, also saying a bit about what we see, how things will develop. So I'll just go ahead. So let's start with the big number, 98%. That is a share of renewables if we're looking at the electricity produced. And this is part of my point here, that we have to be precise here. Do we mean energy, which is more than electricity, or do we need electricity? The numbers are very different if we do one or the other. But in terms of electricity, we're doing quite well. A typical year, and this varies a lot. It is, of course, related to the fact that we have a lot of hydropower. And the amount of rain affects the production that we have. I should also then immediately add that we, in general, produce a bit more electricity than we use throughout the year. So most years we're able to export quite a few terawatt hours of electric power. But currently, for a typical year, we produce close to 160 terawatt hours in Norway. Close to 90% of that is hydro. About 10% now is wind. Then a few percent that comes from thermal generation. That's mostly on oil platforms out in the North Sea. And then we have a little bit of solar energy, very, very small amount. But this does hide the fact that there's quite a bit of solar energy that is produced locally and never shows up in the power system, because it's used by households, so it's used by also other consumers and are not sent out on the grid. So the actual production is somewhat larger than this, just adding that briefly. If we move on to a slightly smaller number, 53%. That is if we look at the share of renewables in the total energy used in Norway. So that changes the picture quite a bit. The total energy use is about twice the electricity, so a bit below 300 terawatt hours. Almost half of it is electricity. Then the next number is a bit uncertain, but it's around 6-7%, which is quite a bit of biomass. It's waste and a few other things. We're still using quite a bit of oil, 27%. That is mostly in the transport sector, in the way of basically fuel for cars and trucks and ships and planes and whatnot. 17% gas, natural gas, that is mostly used in industry, for example, for fertilizer production. It's a huge thing there. Partly also in gas turbines offshore. And then we have a little bit of coal, which is mostly used in industrial processes as a reduction agent. So not for producing heat or electricity, but it's used as a chemical. So 53%, that's quite a bit lower. But let's have a really low number, 7%. That is a share of renewables when we look at the total energy produced in Norway, which also shows that Norway is an odd country. It's really an outlier in many, many ways. So if you compare to the previous numbers, we're actually we're producing about 10 times as much energy as we're using ourselves. So we are exporting. That means exporting 90% of the energy that is produced. And here the fossil fuels are completely dominant. 48% gas, 45% oil, these are 2023 numbers. A very tiny amount of coal, which will probably go down to zero now. This was in 2023. I think it will be zero in 2024. And 7% renewables, which is then hydropower, it's wind, and this tiny amount of solar. So you can see very different numbers here, depending on what we're talking about. Electricity, energy used, or energy produced. So just dig a little bit more into this. We used to have one coal plant in Norway that was up in Svalbard in Longyearbyen. That closed down about a year ago. So the power sector now is essentially decarbonized. And we also produce a bit more electricity, as I said, than we need ourselves. But we think that looking ahead, more electricity will be needed. If we go to the renewables, onshore wind is certainly in a bit of a difficult situation now. There was quite a bit built out previously, and then there was a lot of local conflicts related to onshore wind. And it has basically stopped now. And I think it'll be a few years before we see new wind parks being built on land. Offshore wind has been touted as a way to go, out of sight and so on. So you avoid a lot of the local problems then. But the other problem really has been that the costs have been rising. Another challenge is that outside the coastline of Norway, most of the waters are quite deep. So it's possible there's some areas where we can have bottom fixed offshore wind. So that's going to be, there was an auction recently. There will be a huge wind park that probably start producing in 2031 or 32. There will be another auction on floating offshore wind, but the cost of that is really quite high, and there's some discussion going on now if this really is a very good idea. But I think the government will probably move ahead. There's probably too much invested in this at the moment. Solar parks could be an option, even though you could say that solar is maybe not the most obvious thing in Norway. We still have quite a bit of sun, and especially in the summer half of the year. We have the first few solar parks now being assembled. And then I think it's like 60 or 70 projects now that are stuck basically in the concession queue. And they are lacking the manpower to go through all these concessions. It will not be the massive solar parks that you see in other places of the world. It will be smaller things. And again, there's a fear that this could be conflict with farmland and other things. And possibly also cabin owners, which is really the worst thing you can do in Norway, is to angry the cabin owners. You have to stay away from those. Let's move on to the total energy use again, showing some statistics on this. So these are numbers for the years from 2000 to 2022. The green part is electricity, which is then, as I said, basically completely renewable. There are some other renewables, that's mostly biomass. Also a little bit of biogas, and you can see it's roughly half the total energy as indicated by the 53% number. Then it's the fossil fuels, as I said, oil mostly in transport, gas and coal mostly in industry. One interesting thing here is when you look at the total energy here, it seems like we peaked in 2010. So the peak energy, at least for now, was in 2010, and we actually used less energy, but more electricity moving on. How will this look in the future? We don't really know because it depends on a lot of different factors. And we see that, for example, in the transportation sector, if we electrify cars and lorries and so on, that's quite a bit more efficient than the fossil fuels internal combustion engines. So that would actually decrease the total energy needed. We'll need more electricity, but less total energy. Then we see there's some industrial processes where it's pretty much similar whether you use renewables or fossil fuels. So it won't really change the total energy needed, but of course you want to shift it to the low carbon emission-free energy. And then we have other processes. If we, for example, are going to export a lot of blue hydrogen, then that is going to take up or increase the energy consumption quite a bit. There are some good success stories here. For example, the private cars. We had a new record now last month. 96% of the private cars sold were electric vehicles, and not just plug-in, actually battery electric vehicles. Ferries have been moved, construction sites are changed, and we have even electrified oil and gas platforms. Though we see that several green industry projects are struggling now, either due to lack of electricity or lack of financing. And then final thing, oil and gas. Let's get back to this. This is, of course, the elephant in the room in Norway. If we look at the historic production here, we are way past the peak for oil production, but gas production has increased. The projection over the next years is a slow decrease in both, as we see here. So I'd also like to just point out briefly that that the oil and gas sector, they have sort of been given a new life here after the invasion of Ukraine, because they see that Europe is really, really dependent on this. And if you look at the middle figure here, that is natural gas and gas estate, basically pipeline export to Europe. It's a bit ironic, because if you go back to 2021 or early 2022, about 45% of the gas was coming from Russia. And Europe has been able to diversify away from Russia, but they basically made the same dependence now on Norway. Norway exports 46% here of the gases, natural gas, to Europe currently. There is some progress on carbon capture and storage. So, for example, this project are actually seeing the light now. The first CO2 transport storage service is ready. The first CO2 capture facility at the cement plant is very soon complete, and they will start doing the storage next year. However, there are several things that are unclear here. The role of blue hydrogen is not clear, and there really is no long-term plan for the lucrative oil and gas sector in Norway. And with that, I will end, and thank you for your attention.
Thank you very much, Professor Bakken. I really appreciate your presentation. And Ian Hamilton, do you have a question to Vebjørn Bakken?
Thank you. I think this is a really important part of the story around the energy system and the implications not only domestically, but also globally, because as you point out, a lot of that emission, a lot of that potential real harm is being exported outside of Norway. But interestingly, also then the local exposure conditions or local experience because of climate change, as Jeanette pointed out, are still being felt locally. I'm curious about, is the conversation that you hear and participate in of that reality of exporting, but also still experiencing here in Norway, pardon me, is that discontinuity understood, or what's the conversation? Because of course, the implications financially of Norway choosing to change that picture is quite substantial.
I think it's a discussion that is quite polarized between different parties, and you can also see a geographical polarization here. If you look at the western part of Norway, where most of the oil and gas industries have their activities, I think there is different kind of ideas around this than if you look, for example, in Oslo, where the amount of people voting for the Green Party and so on is quite a bit higher. So there are discussions around this, and I just saw a recent study that tried to sort of put numbers on what would the effect of the economy be if we just stopped searching for oil and gas today. And that looked kind of promising, but of course these are scenarios and it's hard to discuss. I think it's a very difficult thing, this, and it's partly because the oil and gas sector is so strong economically. The finances are important for Norway, but I think also a very important thing is what you touched upon on the renewable energy. Workplaces. People are working in the sector doing, making a good salary. Working in the sector. So I think you can see a lot of climate skepticism in Norway, basically based on the fact that a lot of people are connected to the oil and gas sector in some way and probably want to defend this sector because they see this is how they make their money, make their living.
Yeah. Yeah.
Thank
As you point out, it's a difficult argument.
Yeah. Vebjørn, do you have a question to Ian?
Yeah, I think maybe just more of a comment because, there's a lot of positive things going on within renewable energy, but as you pointed out, there's still huge dependency on fossil fuels, and I guess what we're seeing is really this additionality. So the renewable energy basically comes on top of the fossil fuels, and we're not very good at switching out and doing the transition. So any thoughts on this? How can we sort of start doing the transition as well? So not just adding new stuff, which we've been good at for many years. Always, if you find new energy sources and you start using them, that's easy. But stop using energy sources. That's really kind of the key thing here.
Yeah, I wonder if the financing, not financing, but effectively the cost. So some of the experience that we've seen in Europe recently around the insecurity of supply and the effect that has had on pricing has resulted in a lot of concern from households, from governments around how it is that they're paying for these existing fuels. So, for example, with the war in Russia from Ukraine is affecting that global market. Whereas renewables and the way in which those being affected by global insecurity, it seems less effective. So I would imagine that the externalities of carbon emissions on one hand, slowly ensuring that those are a full pricing model, and then also the reality of when we know for so much of that investment is going to be low cost renewables, because in terms of operational, they've reduced their costs. So I think that there's a lot of changes that could be made in the energy system pricing that could probably incentivize that. Your point about jobs are extremely important. And I think this is again where the equivalence of what a job could be, often this is a real problem area. And I suppose it's more about saying if those jobs continue to grow, we would have concerns. But if the other industries can increase in their labor supply, and at a good quality job, because most of these, in terms of renewables, they're quite technical requirements, so that they have a high value to them. So I think that's another benefit area where these green shoots, as it were, could continue to grow.
I can also briefly add that we've had people looking at the industry in Norway and talking about these green things, that the interest in green project that's really going up and down with the price of oil and gas. So we really see that the industry is moving where the money is here. And the interest is much higher if oil and gas prices are low than when they are high.
Yeah, and you also mentioned, Ian, the challenges with the insurance industry. So the collaboration here between public and private and partnerships to solve the aftermaths. One thing is the preparations. We all saw the pictures from Spain, what happened there the last 48 hours. And then I'm sure tomorrow you will see the pictures from Bergen and the surrounding areas, what's happening here today. And then we had the two hurricanes that hit the southern part of Florida just a few months back. And the insurance industry is taking a big brunt here. So what do you think, what do you see across the globe of what that big industry that very often both are the insurers of houses for people, but they are also, many of them, owner of hospitals and hospital systems?
Mm-hmm. That's right. I mean, the insurance industry and the reinsurance industry are effectively a large part of the investments that, for example, national pension funds might be taking part in. And so there's absolutely a synergy between all of a sudden the costs that are being presented to these industries that have got to be addressed and paid for, but yet also this connection that is to other parts of the economy that they're investing in. Because if economically, lucrative area to invest in continues to be fossil fuels, then as an insurance industry, they have to go with their due diligence, and yet at the same time, their due diligence has got to be climate aligned. So I think that we do see this in terms of investment funds, organizations of divestment, because actually the long-term risks of continuing to be investing in stranded assets on one hand, another indicator that we've included in this year's report. But the real concern, as you point out, is that the losses and damages associated to climate events that are occurring around the world, for those who have insurance, and the cost of that has, in terms of the premiums and prices that will be paid through that, pale in comparison to all those who have no insurance at all. And therefore, we're talking largely about reconstruction efforts, disaster relief, which are going to come in the form of financing, which have costs associated with that to low and emerging economies. Often there's debt forgiveness on various things, but the reality is it just adds to the burden. So it's a real struggle. And I think, again, this ability for us to think across to the others who are experiencing these challenges in the same way that we are. So basically taking that empathy that we have for our neighborhood, our colleagues who might be experiencing these, and understanding that is the same reality, but much worse in those other settings.
But the for-profit organizations will always distribute it down to the clients anyway, because the shareholder needs their money from their shares. And that's what we experienced after Hurricane Katrina devastated New Orleans, and I was living there, and there was no electricity. They had to rewire us and reconnect everything, and we had to carry the brunt. So we had 3 times higher the average of electricity bill per kilowatt hour than any other place in the US for years afterwards, because we had to make sure that the shareholder got their money. So usually, as you said, it's not only the poorest among the poorest, but it's also regular people that are hit that when it's a for-profit system. So here we really need to have government work together with industry, as Vebjørn pointed out, but also with the different other for-profit organizations in order to do this well. We have one question from our audience, and that is, how do we best balance the opportunities that IE provides, including in healthcare, with the concerns about the energy consumption this technology demands? And I don't know, gentlemen, who would like to tackle this?
Well, on one hand, I'm happy to say something around this issue. So I think you're absolutely pointing out something quite important, which is that the growing energy demands of different forms of technology, particularly for those such as AI, which are, at the end of the day, just very computationally demanding and therefore very power intense. And a lot of those, I think it was some value of a Google search might use 1 unit of energy, where an AI powered search might use 100. It was quite an order of magnitude different. There are great benefits that it could provide in terms of being able to analyze and understand large data sources, streams around the world. I mean, there's a lot of groups who are looking at that in terms of the climate data and being able to resolve and understand better climate models. But the implications around powering the systems have got to therefore be focused on ensuring that there are low carbon sources. And so we do see data centers as being one of the areas which continues to seek out the lowest cost energy. And in many cases, the lowest cost construction, lowest cost rates are going to be associated to renewables. So whether that's a data center that is being solar powered in the area of, say, Texas, or that's going to be a geothermal, in the northern parts of, for example, Norway, etc. I think that there are opportunities there. But it's as you point out, Jeanette, we have to ensure that the money says the right story and sets the right standard. So if the cost of renewables for construction are lowest among all forms of fuels for use, for electricity, for example, we have to ensure that those are incentivized appropriately and that they're sought. So AI is going to be a tool on one hand, but the real story is around the power demands that those have.
Yeah. Thank you, Professors Bakken and Hamilton. We are then moving on in our program. The next segment, we will be joined by 2 other speakers who will address climate, nature, and health interaction and impacts in Norway. And both, once both of them have presented, we will open for another Q&A. So please, ladies and gentlemen out there, put your questions in the chat. So first, I would like to welcome Dag Olav Hessen, professor and leader of the Center for Biochemistry and the Anthropocene at the University of Oslo, who will address nature, climate, health interactions, and followed by Dr. Kristin Aunan, Research Director, Center for International Climate Research, who will address the relationship between climate change and health in Norway. So please, Professor Hessen, the screen is yours.
Thank you. Now I think the screen belongs to all of us. So I will start with putting nature into the equation here and show how intimately linked the climate and nature plus health are. And I start with a kind of broad scope and then narrowing it down to what is specific for Norway. Probably not need to spend much time on this, but this is just to point out that, of course, all these sustainability goals are tightly interconnected, and to some extent they all rely, for obvious reasons, on those down in the right corner, the biosphere components. So I speak here mostly about the climate change and loss of nature. And this is probably the core argument for why we need to see climate and nature in context. It might seem kind of complicated, but the easy explanation is that among our fuels, fossil fuels emissions, cement industry emissions, and other kind of emissions, that's the red numbers here, less than half of these remains in the atmosphere. Still, that is sufficient to currently have brought us up to a level of 420 ppm, which is something this planet have not experienced for the past 4 or 5 million years. But the point is that there is a net uptake in the ecosystems, primarily on a timescale that's relevant to us by photosynthesis. And this is the largest of all ecosystem services. There are, of course, a number of ecosystem services, but this is by far the largest today, and explains why a healthy nature that maintains its capacity to take up and sequester and store carbon is essential to the development of the climate on this planet. So for instance, if the Amazon should hit a tipping point and become a savanna, that will release vast amounts of carbon stored in the wood into the atmosphere, plus of course being a catastrophe to the biodiversity and indigenous people. So there are a number of these kind of feedback processes that we study in our center, also permafrost release, etc. And many of these could turn into real tipping point, which is also something we look into. But there is about 50-50 uptake of CO2 in land processes and oceans. And we are about to change this now in a bad direction. So if we look at this historically, there is really one thing that matters when it comes to drawdown of CO2. And we cannot rely on the technical devices. They might, some of these abilities to sequester and store carbon by technical means, as Vebjørn touched upon, are of course something we need to explore. But by and large, to come down to 2.1 degree, which is the optimistic target as it looks like now, means that we need to take care of the ecosystem's ability to sequester and take up and store carbon. And especially since we quite soon need to come to net zero release, the only way that really can suck out sufficient amounts of CO2 from the atmosphere, and also keeping itself with its own energy and provide resources and foodstuff for humans, that's nature itself. And there are other reasons also to take care of nature for the actually literally buffering against the climate change effect. So the things that Jeanette talked about now with the avalanches and floodings, things we have seen going on in Spain, now in west coast of Norway and everywhere else, is of course not prevented by nature, but it's buffered and lowered by nature in many cases. And as I said, there are of course a number of ecosystem services on top of this that also affect health to a large extent. And of course, this is something that have been known for a long time. It's the reason why we gathered here today, that many years ago, Lancet started identifying climate as the top threat to global climate. And also we see that now there are calls for seeing climate and nature crisis combined when it comes to health emergency. I will not go into detail here because this is something we already heard and it's not specific to Norway, but it affects, of course, also Norway as well. We see a number of parasites and diseases also affecting Norway more heavily thanks to climate change. And again, this is nothing specific to Norway, but again, it's worth reminding that many of the zoonoses like COVID and others are related to human interactions with nature. And then to something that's probably more, I wouldn't say Norwegian specific, but this is a huge debate in Norway today. And it's a under-communicated era that we depend on nature also for happiness. Nature should not be free of use without any anticipated costs. It should not be discounted as we do today, and it should not be treated as an externality for many reasons. But one of these reasons is because of its huge impact on human health, both physical and psychological health. So this is related to the loss of nature, so-called eco-sorrow, and loss of life quality, and it's of course adding to the well-known climate anxiety. And this is really the heated debate in Norway today. How much of nature should we sacrifice for the so-called green transition? And we have a continuous debate on the use of windmills on land mostly, but also to some extent on sea, solar panel installations in nature, more hydropower, etc. And the issue with all this is that it comes with a heavy toll on nature, but also, of course, then on human well-being, human health, human experience, human happiness. And there is a classical story saying about a group of Dutch tourists entering Norway and asked the driver to stop on a very remote place. And he said, "Why stop here? There is nothing to see here." Now that's exactly the point. We have never seen nothing before. So there are a number of studies also showing that wilderness and absence of windmills and other installations in nature has a huge impact on human health. So I might call it irrational, but I would still say this is legitimate and important arguments for seeing climate, nature, and health in context. So with that, I stop and leave the floor to Kristin. Thanks.
Kristin, please. Will you?
Yeah, I will share my screen. So please let me know when it works. And, starting the slideshow. Is it okay now?
Very nice, thank you.
So thank you for the opportunity to speak at this event. Now, Dag Olav has given us a broad introduction to the topic related to climate change and health, and I will dig into one specific part of the climate change and health issue, which is related to ambient temperatures. In Europe, extreme events are considered the most important health risk factor related to climate change. So what is the situation up here in the cold north? I thought I should give some brief results from a recently finalized project on that, to say something about what do we know about health impacts related to ambient temperature in Norway, and then go on to ask the question, what is the role of vegetation for city temperatures, which is then subsequently important for human health potentially. Say something about the development in our part of the world. So as shown by very many studies, there's a U-curved relationship between temperature and mortality risk, with increasing risk, for instance, to mortality, with increasing temperatures and with decreasing temperatures beyond some optimal range. That is different in different parts of the world, depending on what we are used to. So the figure here shows one of the core findings in this recently finalized project, where we can see how the sensitivity differs, so the vulnerability of different age groups differs. So we see that elderly people are more vulnerable to heat stress. And this is related to the fact that, I mean, there are very many other topics or factors beyond temperature that affects the population risks related to temperature. For instance, chronic conditions such as cardiovascular disease, lung diseases, diabetes, and frailty are very important in increasing the vulnerability, which obviously means that for older people, and if there is a population with a lot of old elderly people, the vulnerability in the society will be higher. We have also used the same data set. This is for very many cities in Europe to look at different other factors. And we see that women are, if we stratify by gender, we see that women are more sensitive. And also there are important socioeconomic factors that might bend this curve up or down. And importantly, we also find very clear results that green space has an impact on these curves. So it mitigates some of the risk in the areas where there is more green space. And we also find that air pollution is one of the really important factors that can modify the relationship between temperature and mortality in this case. So what's the situation in Norway? Well, we have an aging population. Within 2050, 1/4 of Norwegians will be older than 67 years of age. Obviously, it will increase our vulnerability to heat stress and cold stress. Another characteristic in Norway is that older adults, to a large extent, are generally quite self-reliant. So that, for instance, among people more than 80 years of age, only 13% lives in nursing homes, and less than 1/3 receives help from the municipality on a daily basis. And this is, of course, generally a good thing with a society. It's resistant. But in case of extreme events, it could actually imply and enhance the vulnerability, because many of these older people, the more vulnerable people, are then not under the surveillance of healthcare workers. These are the results from this project when it comes to Norway. The figure shows estimates regarding current and future temperature-related deaths. And as we can see from these curves, the blue curve is cold-related deaths per year over the century. And we include both climate change and demographic change in this figure. And we can see that currently there are many more cold-related deaths than heat-related deaths. But if we look into the future using the SSB 370 scenario, which is relatively pessimistic, but unfortunately probably realistic, we see that the projected increase in heat-related deaths nearly cancels the reduction in cold-related deaths. So it's about 250 more heat-related deaths and about the same reduction in cold-related deaths. And again, back to the elderly, more than 90% of the increase in heat-related deaths and the reduction in cold-related deaths occur in the population above 75 years of age. And we have a web tool if you want to look at the details for 800 European cities. So you can go to that link. Okay, so while cold weather may become a smaller health risk in Norway in the future, we have to prepare for more hot weather as well. And cities are often regarded as hotspots for heat exposure. And there are indications that the temperature increase in cities is related not only to the general warming trend, but also to the amount of vegetation, because vegetation cools the environment through shade and evapotranspiration. So the figures here show the trends in North and West of Europe regarding changes in vegetation cover. I call it greening or graying along the axis here, and how that relates or is associated with warming. So warming is up here and cooling is down there. And basically we see that this is based on the satellite data. There are a lot of uncertainties I will not go into. But the thing is that the main finding is that most northern and western European cities are warming. And the rate of warming seems to be correlated with the rates of graying. So in context of climate change, green space has been highlighted as a potential means of mitigating what we call the urban heat island effect, which is the thing that in inner cities it's often hotter than in the surroundings. So this figure is some ongoing work at CICERO where we try to investigate, actually for many thousand cities around the world, but I just picked out some northern cities. What is the relationship between the change or difference in surface temperature between urban and rural area? So a positive value would mean it's some kind of urban heat island effect. And that's the black line, and the green line, difference in green space between urban and rural areas. So I think the figure for Oslo is quite, it was actually quite surprising to see the very clear indications that Oslo is seems to be losing green space since 2003. And at the same time, again, using satellite data, there is a strong indication of an increase in the urban heat island effect. There are also similar trends in Stockholm and Copenhagen and in many other cities in Europe, whereas in some cities we find more surprising trends, like in Helsinki. We are still trying to interpret all the figures here or the data. But I suppose that the main thing here is that green space is just one factor. There's a lot of other factors that can contribute to urban heat island, and we are looking into, for instance, building density, etc., to study that in more detail. So just to conclude, global warming, even in the cold north, it would not save us. It will likely not reduce the net number of temperature-related deaths in Norway, and many northern European cities are losing green space, and this seems to be at least partly associated with the increasing urban heat island effect. Thank you.
Thank you very much to both of you. And we have a question in the Q&A. And this is from Benjamin and Björn from Ahu, asking, are there any tools or measures that can relieve individuals / communities / societies from ecological sorrow to avoid paralysis and furthermore fuel engagement? So, Doug, do you want to take the first cut at that question in the Q&A?
I can give it a try. I think, as far as I know, there are no professional aid to do this. But I think it's very important in all contexts to communicate that there is no reason to give in or give up and become paralyzed. Rather the opposite. I often say during lectures and to talks to young people especially, that there is definitely things to do. So when they are asked, are there any reason today to take an education when everything is going to collapse? Is there any reason to think about family or even any reason to get up in the morning? I say that's the wrong way of seeing it, because the planet will survive and so will humanity, but of course with increasing costs with any 10th degree of temperature we are up, and every square kilometer of nature we are losing. So rather than give up, I see this as kind of motivation to do something, because even small impacts from individuals can sum up to huge achievements. Not probably a direct answer, but I think it's important to argue against this passivity and the tendency to give up or give in.
Yeah, I think you're right. So if we were looking back at, even though it's many years, decades and centuries since the last time there were challenges, we wouldn't have been here if they had given up. So we owe it to humanity to continue. But there is a question I have to both of you, and that is, are Norwegians fully aware of the tight coupling between climate and loss of nature and its bearing on health-related issues besides feeling doom and gloom? Kristin, this is for you, perhaps.
Yeah, I think the short answer is no. I think there is very little attention, actually. I mean, in our projects, we have done a lot of dissemination activities, and we are actually quite surprised. Not only, the link between nature and climate change, but the general knowledge about how climate change can impact human health. Then it gets even more complicated when you bring in other factors like nature loss, and how it affects ecological systems. That, as Dag mentioned, they are an important buffering system for many types of climate change related healths that are also important for climate change impacts that are important for health as well. So I really think we need a lot more of education, and Ian mentioned that there is more, about climate change into health curriculums and generally in education. I think that's very important for us who work in the field to contribute to developing those curricula and contribute with knowledge, so that it's not only something in the academic community, but that it is shared for use and increased understanding.
I can brief to that. Yeah, I think Kristin is completely right that there is an ignorance about the tight connection, although it's a growing awareness that you cannot see loss of nature and climate as separate issues, even in Norway. But by and large, there is a climate ignorance, I would say, and also climate resistance in Norway. But gradually, people start to see these things in context and eventually also see that this is health related. So it's not just sectors of the society, but it's highly implemented in everyday life and everyday well-being of people.
Yeah. Thank you very much to both of you. And I think it's important to stress that the extremely close link between climate, the nature, human health, as well as our life and our wellness and our feeling of purpose. And I think it has always been there, but I think we have taken it for granted. And I think we have thought that it didn't relate to us. Having lived through the COVID, the first major pandemic in, 80, 90 years, I think has changed the perspective. And so might also the talk of the next speaker. I am delighted to welcome Tormod Rogne, Associate Professor at the Department of Community Medicine and Global Health at the University of Oslo. Tormod Rogne will discuss the impact of heat on pregnancy outcomes and child health. And ladies and gentlemen, this is an area that is not covered and not measured in a way by the Lancet Countdown working group. So Professor Hamilton, we really want you to lend an extra air to this one, because we think this is extremely important and we need perhaps to also include this in future measures. So please, Tormod, share your screen, and the screen is yours.
Thank you for that pitch, Jeanette. That's a nice introduction. I'm very happy to join you all on this event. Again, my name is Tormod Rogne. I'm a medical doctor and perinatal epidemiologist here at the University of Oslo and also affiliated with Yale University. And I'm very grateful for the opportunity to talk about this topic on how climate change and extreme heat affects pregnancy, maternal health, and child health, as I think that this indeed is an overlooked topic. So the agenda for today's very brief presentation from me is, first, I'm going to talk about why I think this is important, what do we know at this point, and finally, what should we do with this knowledge, and what are the next steps? So first out, why is this important? Well, we know that there are 250 million pregnancies in the world every year, 140 million live births. And whatever happens in pregnancy may have lifelong impacts on both the mother and the child. So this is a huge part of our population. But for some reason, I'm not sure exactly why, but we have sort of not generally considered them as part of this set of vulnerable groups in terms of climate change and heat stress. And I will make the case, as you will hear, that I think we should consider the pregnant population as vulnerable to climate change. And if we do surveys of the general population, there have been several studies conducted on this, asking passersby who do they think is at risk at times of a heat wave? And generally, the response is that roughly 1 out of 10 recognize that the pregnant population is a risk group in the time of extreme heat. So these surveys have all been done in non-Norwegian countries, but I think that we would find something similar here in Norway. And I think part of this is a fault of ours, of researchers, public health professionals, policymakers, that we haven't really flagged this concern. And if we look at the health guidelines from governmental health agencies, etc., in different countries, we will see that in many countries, the pregnant population is indeed not listed as a vulnerable group during extreme heat. So in the UK, for instance, they mentioned several risk populations, but not the pregnant population. The same in Australia. In South Africa, they have identified the pregnant population as vulnerable. Same in the US, they have identified them. And also the WHO recognizes the pregnant population as vulnerable. Here in Norway, however, we have not considered the pregnant population as vulnerable. So I will make the case again that I think that there is reason to consider the pregnant population as vulnerable. So I will now briefly go through what we do know about how extreme heat affects pregnancy. So in this continuum from conception to time of birth to short and long-term outcomes after pregnancy, the vast majority of studies have been conducted on these more immediate birth outcomes, such as preterm birth, low birth weight, and stillbirth. Not necessarily because these are the most important, but they are easier to measure than many of these other outcomes. I will go through some of the literature on this topic. So here is a systematic review published a few years back that did a synthesis of 70 individual studies, which found that if the pregnant women experience a heat wave in late pregnancy, there is an associated 16% increased risk of preterm birth. There's a 10% increased risk of low birth weight birth, and there's a 50% increased risk of stillbirth. Now, this paper is already 4 years old, and since then, there have been numerous additional papers generally supporting these findings. And I would also like to highlight that there is considerable inequity in who is the most affected by heat stress in pregnancy, where racial and ethnic minority groups suffer the greatest consequences. And the same goes for socially disadvantaged groups such as low-income families. There we see the greatest harmful associations between heat stress and adverse pregnancy outcomes. If we look at complications that reveal themselves earlier in pregnancy, I've put all of these outcomes in italics and with a question mark, not because they are not necessarily true, but I consider the evidence basis as not as robust as for preterm birth, low birth weight, and stillbirth. But I think it is worth reflecting on that many of these outcomes directly affect maternal health, such as several studies indicating that there's an increased risk of severe maternal morbidity. For longer-term outcomes, and by this I mean that the exposure, such as heat stress, happens during pregnancy, but the outcome reveals itself years later. Here we know very, very little. There have been very few studies on this. And that's why we conducted one study, which was published earlier this year. It was published a couple of months back in Lancet Planetary Health, where we evaluated what is the link between heat stress and high ambient temperatures in pregnancy and risk of childhood acute lymphoblastic leukemia. And there are many reasons why we wanted to study this particular outcome, and in the interest of time, I unfortunately won't have the time to go through those reasons. But our hypothesis was that we suspected that heat stress and experiencing a heat wave in the first trimester would be associated with an increased risk of childhood acute lymphoblastic leukemia. And we hypothesized that there would be no such association before the onset of pregnancy, and also no association later in pregnancy. So this figure I drew at the stage of the grant proposal before we had the data and before we'd done the analysis. And when we did the analysis, the results turned out like this, which fitted our hypothesis quite well. Indeed, that we found a very robust association between extreme heat in early pregnancy and risk of childhood acute lymphoblastic leukemia. So these were some examples of the evidence basis for heat stress in pregnancy and how it affects pregnancy and child health. The question is then, what should we do with this information, and what are the next steps? And I think that there are three focus areas. We need to learn more about the mechanisms at play. We need to gain context-specific knowledge. And finally, we need to adapt. So first, to understand the mechanisms at play, we have a ton of hypotheses, but we know very little of actually why do we see an increased risk of preterm birth due to heat stress. And the same holds for all of these other outcomes. So we need to do more mechanistic studies to identify what are these pathways, so we have something to intervene on. And just a few weeks back, there was a really nice study that tried to come at this question. They observed that when the pregnant woman experienced a heat wave in mid-pregnancy, there was a 20% increased risk of preterm birth. And they went a step further and found that actually a quarter of this association is mediated through maternal hypertension that occurs in pregnancy. So now we know that, oh, actually we can intervene on hypertension and potentially prevent some of the increased risk of preterm birth that is accompanied with a heat wave. So that's just one example. Another example is this really innovative study evaluating 100 pregnant women in the Gambia, where they did Doppler ultrasound during pregnancy and found that with increasing ambient temperatures, there were objective evidence of fetal heat stress. So one evidence of this was an increase in fetal heart rate due to increasing ambient temperatures. And they also measured umbilical artery resistance and found signs of fetal heat strain due to high ambient temperatures there as well. So I think that in order to prevent these adverse outcomes in pregnancy due to heat stress, we need to know more about these mechanisms. And fortunately, there are many good projects funded and underway, so we will know much more in the coming years. The second thing that we need to do is to gain context-specific knowledge. And this will be different depending on which context we live in. In some settings, in some countries, we need to gather more data on these adverse outcomes so that we can actually track whether there is an increased risk of these adverse pregnancy outcomes with heat stress. And here in Norway, we are good at tracking these sorts of things, but we don't really know whether the literature from other countries apply in the Norwegian setting. And this is slightly what Kristin was talking about as well. I mean, Norway is a cold country, but we do have times of high temperatures. This is just a very crude graph showing the number of weeks with a mean weekly temperature above 15 degrees at Blindern in Oslo, and similarly with the number of weeks with a mean weekly temperature above 20 degrees Celsius. And in this last case, this is when we actually do see an associated increased risk of adverse pregnancy outcomes. So I agree that we don't have that many weeks with extreme temperatures, but we do have them. And we could also make the case that actually it might be that we in Norway aren't that adapted to these temperatures. Like the study that I mentioned on childhood leukemia was conducted in California, where more than 90% have access to air conditioning units. The same is not true in Norway. So we don't really know how the literature from other countries apply in Norway or the Nordic countries, because very, very few studies have been conducted in this kind of setting. And as you all know, the future holds for us many more hot weeks. Okay, I'm mindful of my time. I will just finish up this final slide. The final thing I would like to say is that we need also to adapt. First and foremost, I argue, as you can tell, that we should recognize the pregnant population as vulnerable to extreme heat. And then we need to have individual level adaptation, meaning that the pregnant population need to follow the same advice as all the rest of us at times of extreme heat. We have community level adaptation, which can range from anything from heat warning systems to improve urban green space areas, which Kristin told us that is heading in the wrong direction in Oslo, at least. And there's a lot we can do at the policy level. So for instance, one example of this is that pregnant women can be exposed to extreme heat while working outdoors. And there's this disparity element to it where low-income women work more outdoors and are more exposed to extreme heat. So we need to have policies in place so that they have equal pay while not working that day outdoors when it's extremely hot. So those are some examples of how we could adapt. And with that, I'm happy to take any questions you might have.
Thank you very much. I know I have a question from Kristin.
So yeah, thank you, Tormod. This is really interesting, and I agree. It's an under-communicated topic, the risk of heat stress to pregnant women. There are a few studies, of course, in some part of the world, but so my question is related to exposure assessment, which is always a tricky thing in epidemiology. I mean, in some parts of the world where this problem is probably much more important than in Norway, for instance, in African countries, sub-Saharan African countries, there is this issue about data on heat stress or temperature and other confounding factors like air pollution. So I don't know if you have worked in that setting and how you would address that. But importantly, but that's also related to Norwegian setting, the question about indoor versus outdoor exposure. That's again typically a problem in many types of projects. But how do you deal with that? How do you? I mean, many people spend more than 80-90% of their time indoors, and you have no idea what's the temperature there compared to outdoors, maybe.
Yeah, I very much agree with you, and I mean this. So in our case, we're dealing with it the same way as I would argue that the whole of literature on heat stress. What we have is ambient temperature, so outdoors temperature, and we see these associations with adverse events. And I know that there are some studies ongoing that are trying to, and you have these sort of these small things you can clip on as a wristband or whatever to estimate what is the temperature that you're actually exposed to at the individual level. Because I agree with you, like, of course, we don't know what is the individual's actual exposure to the environment. So I agree with you. This is sort of a limitation with most of environmental epidemiology, that it's difficult to get at the individual level exposure. But yeah, I don't have a quick solution to it, other than it would be good to have these instruments.
So thank you very much, Tormod. Ian, we have really appreciated you joining us from the Lancet Countdown team today. Do you have any reflections or questions to Tormod? We have a few minutes left, and I have 30 seconds for you.
Thanks very much, Tormod. That's really great analysis. I suppose the question would be, in a lot of cases, we look at ways in which public health systems can be alerted and work with at-risk individuals. So I was curious about what you would envision as being a way to help, mitigate the risk, but by adapting, existing systems. So just any commentary around that would be very beneficial.
Yeah, to the pregnant population, you mean?
Yeah.
So
very short. Very
short. Well, that's difficult for me. I tend to go on and on. So I struggle a bit, because on the one hand, we don't want to alarm the pregnant population, because they have already so much they have to worry about. The first time they're pregnant, they get so much information. But I know that the midwives, the nurses, and the doctors are very trusted sources of information. We have a system, especially in Norway, but in many, many countries, where women go to antenatal routine follow-up. So we have actually quite a good opportunity to, in a quiet environment, provide sort of easy take-home messages on how to deal with heat stress that won't sort of upend their lives. I mean, these are fairly simple things that recommendations that we should all follow, but perhaps the pregnant population should follow it a bit more diligently.
Thank you very much. That was a short question. I appreciate that. And we have one speaker left. Unfortunately, he could not attend directly, so we have a presentation. But before I show that short video, I want to take the opportunity to say thank you very much to all the panelists and all the contributors and the speakers, and to those of you that has been listening. And I will give the last word then to the our state secretary for health, Usman Ahmad Mustak, and you have to bear with me while I share the sound and start this, okay? But anyway, thank you very much for me. And I will share this.
Dear friends, thank you so much for inviting me on the launch of the Climate and Health Countdown for 2024. This is very special for me, because I started my work back 15 years ago as a young student focusing on climate and health issues. And now in my current position as the Vice Minister for Health, the effects of climate change we consider them crucial for the future of public health. And it's a long time that the world recognized this link, and we're now seeing that in both the COP meetings in WHO and in the G20 meetings. I'm currently attending the health ministerial meeting of the G20 in Brazil, where climate change is actually one of the core agenda items. And this is just a testament to how far we've come. I mean, 15 years ago, as young students, when we were running around in the UNFCCC COP meetings, the understanding of how crucial the changes in climate were for public health were negligible. And we've seen that this understanding has risen up, partially thanks to efforts like the Lancet Climate and Health Countdown. Now, we estimate that in the Norwegian health sector, just alone, we stand for 5 to 6% of our nation's total carbon footprint. And we expect that changing climate will affect morbidity and the delivery of health services, not only in the global south, but also in global north, and as far north as in Norway. And we shouldn't just passively accept this, and instead, the health sector has to go in front to mitigate and adapt, and by setting an example. If you really believe that climate change is one of the biggest threats to public health, then we also gotta take a stance and a measure in the health sector. As Lancet had a specific focus on energy in this year's report, I'm happy to report that the Norwegian hospital sector is working to phase out all use of fossil fuels for heating instead, and will depend on remote heating systems, including when feasible, based on extracting heat from groundwater. This is really innovative, and it saves money, and it obviously also saves the climate and nature. We have over the last years also started work to better reflect on how we should address climate and health in the health sector, not only specialized healthcare sector, but also at the municipal level. And I would like to mention some measures that we have carried out so far. So at the specialist healthcare sector, the hospital sector, they've set concrete climate goals for greenhouse gas reduction. And they're addressing them both through improvements in infrastructure and through requirements for public purchases. Now, this is where the majority or the most of the climate gas emissions comes from when it comes to the specialist healthcare sector. Now, consequences from extreme weather events are to be integrated in the sector's preparedness plans, and this is also important to ensure that hospitals can sustain essential operations in extreme weather events, and that distributed services reach those who need services, basically, when these extreme weather events hit. We have also started an assessment of public health effects of climate change in Norway, and we expect that certain diseases will increase in numbers, and the burden of disease will also increase from certain, especially transmissible diseases. However, I think it's also important to acknowledge this, that our knowledge is limited, and we need more research to increase our knowledge. So that's also a crucial point of our effort. And we should also recognize that a number of mitigating and adaptation measures launched in other sectors have very positive public health benefits. This is particularly the case in the way that we build our urban centers. For example, greener urban centers reduce pollution and provide citizens with areas to socialize and get more active. Greener surroundings have proved to improve mental health, and making it more attractive to walk and use bicycle prevents inactivity, and it is an important impetus to improve physical activity. So as my years as a municipal politician, implementing health in all policies is most easily done at the local level, because there it's very easy to also argue why we should build in a certain way. And I want to finish by commending the University of Oslo for arranging this event, the 7th launch event for the Lancet Countdown report. An independent, scientific-driven, verifiable knowledge generation is more crucial than ever as disseminating that knowledge which you all contributed to today. So a big thanks to you and to all the presenters who have contributed today.
Thank you very much to State Minister Usman, a former UIO medical student who started working with the Center for Global Health a decade and more ago. And thank you to all of you. And the little we can do, each one of us, is what makes the world go round. So have a blessed afternoon, and thank you very much.